Get this question all the time. What is leaky gut? Other terms for it would be increased intestinal permeability, intestinal hyperpermeability, but I call it leaky gut. Now remember, if your gut leaks, so too does your brain, and that then explains a lot of these symptom domains that span many, many different diagnoses. There are many, many, many epithelial cells that line not only your intestinal tract, but your blood-brain barrier. These are held together very tightly by what we call, wait for it, tight junctions. These can become unraveled, and when that happens, things can seep through your intestinal tract or your blood-brain barrier that ought not. 80% of your immune cells reside in your gut. When these foreign then substances, usually proteins, often fragments of microbes, viruses, bacteria, fungi, parasites, they get in there and then they launch an immune response, an exuberant immune response. What does that look like? Depends on a lot of things. Your genetic endowment, your early life experiences, everything that's ever happened to you, your current bad habits, blah, blah, blah. But what that ends up leading to diseases of civilization, chronic degenerative diseases. Remember, Hippocrates said all disease begins in the gut. Well, what then are the symptoms I look for that would suggest leaky gut, intestinal hyperpermeability? I'm glad you asked. I'm really looking for systemic more than gastrointestinal symptoms. Certainly if you come to me with GERD, reflux, acid indigestion, constipation, that's going to tip me off. That's kind of a duh. At the same time, most symptoms associated with leaky gut are extraintestinal, outside of the GI tract. What do those look like? First and foremost is going to be fatigue, fatigue, fatigue. Second thing I look for, and that would be lack of joy. Anhedonia, we call it. Not only do I not want to do anything, even if my friends drag me out and make me do it, I don't enjoy it. That's inflammation. When I think inflammation, I think leaky gut. And then lastly, it would be brain fog, fuzzy thinking, lack of executive functioning. I have this do loop thinking, oh my goodness, and my brain won't stop, but my body won't go. Whenever I see that mixed wired and tired kind of presentation, I think inflammation, I think gut. There are tests that I can do, stool tests, blood tests, to confirm the diagnosis. Sometimes I will do that. Usually I will not. I'm not going to waste your money on that if there's a strong presumption clinically of leaky gut. Well, what do I do if I think you have a leaky gut syndrome? Again, I appreciate the question. I'm going to do lots of things. It starts with sealing and healing your leaky gut, resuscitating your presumably tired adrenal glands, right-sizing inflammation, balancing hormones, neurotransmitters. I'm going to support your detoxification pathways and promote mitochondrial health. So that's the big six. And I always start with seal and heal that leaky gut. I'm going to use lifestyle modification. You better get your sleep. You better clean up your diet. I'm going to identify with you a default diet to which you can retreat when you have symptoms. I'm also going to use a lot of supplementation. Initially, I'm going to go with a product called OptiTox, GHI, gastrohepatic immune. That is to upregulate, increase the activity of your rest and digest parasympathetic nervous system. I'm going to tone down your fight or flight. And after you take 2 weeks of this, then I'm going to graduate you to leaky gut repair. I try to pick supplements, nutritional supplements, that will serve more than one purpose, that will help tidy up that leaky gut, will at the same time support those tired adrenals and, moreover, right-size inflammation. Sometimes they also will help directly balance those neurotransmitter and hormonal imbalances. But I've got strategies, and you're going to get a number of things. Now, how safe are these natural approaches? Well, let me just slap this on you. You are 60,000 more times to have a side effect from a medication than from these supplements. Enormously safe. And they can work pretty quickly. I can really help with GERD and acid indigestion and constipation. Some of the other things will take longer. Your energy, your concentration, your focus, your vigor and vitality. That's a little bit slower because it will take a while for me to resuscitate your tired adrenals. I measure cortisol in almost all of my folks, salivary cortisol 4 times throughout the day. The same time I'm measuring your neurotransmitters. And what has struck me and really surprises and even sometimes moves to tears my patients and clients is I'm a flatliner. I've got no cortisol because that's what's hit first when you're stressed, and your stress response is overused, and thence the inflammation and the leaky gut. It's all tied together. That's why those are the first 3 things I do. Seal and heal your leaky gut, resuscitate your tired adrenals, right size inflammation, off we go. Can and how do I combine the traditional mainstream allopathic medical strategies with these complementary, alternative, integrative, functional, what have you? Yeah, I do it all the time. My practice is called integrative medicine, integrative psychiatry, because that's exactly what I do, is I try to combine the best of each world and at the same time hopefully get by with less medication, mitigate side effects. Okay, so the stakes are high. Not only your current level of suffering, your misery, I don't have to tell you about that, and I'm sorry for it. We want you to be that better person that you know you are and can be and have been and will be again. R, reduction in suffering. O, optimization of functioning. I, improvement in your quality of life. I want you better than you've ever been. I also want to, at the same time, forestall those deadly, degenerative, heartbreaking illnesses that are associated with leaky gut. Look it up. Alzheimer's, Parkinson's, Lou Gehrig's disease, heart disease, most types of depression, autoimmune illness. Most of that pain you have is inflammation, leaky gut. We want to address all of those symptoms. Can't say I treat those illnesses now. And we want to then move you forward to be that person that you already are. Call us. That's how we get started. You give us a call and we will take it from there. Hope to hear from you soon.